Right, good afternoon, everyone. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, here to give a COVID-19 update for the City of Chicago. So we will start with our update for the emergency travel order. As of today, the travel order applies to 16 states. We have added the state of Utah because they are averaging now more than 15 cases per day per 100,000 population. And we are removing, you will see, quite a list of states, really reflecting a lot of the improvement across the country. We're removing Florida, Idaho, North Carolina, Texas, Hawaii, and Nevada. I do want to note that the state of Wisconsin is not being added to the quarantine order today, but there is a high chance that it may be added next week. Wisconsin has in fact just exceeded that 15 cases per 100,000 mark, but similar to what we did for Indiana a few weeks ago, recognizing that people need time for planning and that it was quite a sharp spike in 1 week for a neighboring state, we will not formally add them today, but we are advising against travel to Wisconsin. I want to highlight that Wisconsin has had the most cases that it's had at any point since COVID broke out last week, and they are having percent positivities that range from the 13 to 17% range and problems across the state. So if you're able to avoid travel to Wisconsin this week, please do so, and we will continue to assess the numbers. If they remain high, Wisconsin will be added next week. I also want to make a special comment about Florida. Florida, as you may recall, has been moving a little bit on and off. They were in our buffer period, meaning they had had 1 week below that 15 cutoff, but then had a surge again, and we were not able to remove them last week. What we have learned is that there was, and you may have seen the national news around this, there was a very large number of cases that were reported in the state of Florida all at once that had caused a surge. Those were not all cases within that week, but it was due to some delayed reporting in Florida. And so in that context, now that Florida has had multiple weeks without that surge below the 15 cutoff, we did make the decision to remove them this week. You will see that in the red and white stripe, those are our 3 states that are in the buffer period. They've had 1 week now below the 15 case per 100,000 cutoff, and if they improve, continue that improvement, they will be removed next week. So that's Louisiana, Mississippi, and Kentucky. I want to highlight that different from what we've been seeing for much of the summer, the focus of COVID-19 right now is very much in the Midwest. Leading the country in terms of cases per population are North Dakota and South Dakota. And then that's followed by Oklahoma, Missouri, and Wisconsin. And you can see those red states there are where we are seeing growth. And unfortunately, that is very near Illinois and our area of highest concern right now. As a final reminder, the list of quarantine states is updated every Tuesday. Quarantine for any new states goes into effect on Friday at 12:01 a.m. States that are removed from the quarantine list are effective immediately. I'll note that Illinois as a state is now at 13.4 cases, below that 15 per case per 100,000 cutoff, and Chicago itself is currently at 9.8 cases per 100,000 per day. Here are what our numbers and our case rates are looking like right now here in Chicago. As always, you can go to chicago.gov/coronavirus. Right up at the top, you can see all sorts of data related to the latest in terms of cases and hospitalizations and deaths and capacity. But this is our overall curve, and you'll see that over the last couple of weeks, we are seeing some improvement in terms of our case numbers. We are currently averaging 263 new cases per day in Chicago. As a reminder, when we are over 200 cases per day in Chicago, we are still in a high incidence or a high risk state. But given that we were at more than 350 cases back a couple of weeks ago, this is definite progress. Our current test positivity is at 5.2%, and this is the test positivity, which is the way that the state monitors positivity. I'll note that this is lower than there's only one region in Illinois that is lower than Chicago. That's the Champaign area, largely due to the large amount of testing happening through the University of the University of Illinois at Champaign-Urbana. But that test positivity is still above the 5% mark. That does note sort of one of the markers that we're really looking for as we hopefully think about being able to eventually reduce some of the restrictions. Testing itself also, one of the reasons that the numbers are a little bit lower and that the test positivity is high is partly affected by the fact that this last week of testing did include the Labor Day weekend, and we saw low testing numbers over all 3 of those days. So that is part of that. We are hoping to see that test positivity come down. I also want to highlight some good news related to race ethnicity. So as we've been talking really for the last couple of months, we've seen Chicago cases very disproportionately among Latinx, so Hispanic or Latino Chicagoans. But those rates have been sharply declining, again, just over the last week and a half to 2 weeks. Huge thank you to everybody who has been working so hard to make sure that outreach and testing and resources are available in these communities. It's good progress and absolutely the way that we want to be heading. I also want to highlight some good news related to age. You'll see that in red here at the top, our 18 to 29-year-olds are still disproportionately where we're seeing cases, but those rates also have been declining. And so it's good to see that the progress that we're seeing in Chicago is being driven both by the age groups and the race and ethnicity groups that have been some of the hardest hit in recent months. So that's some more good news. Our hospitalization numbers continue to look good. We're averaging fewer than 15 Chicagoans being newly admitted to the hospital each day, and our capacity numbers remain adequate. Deaths also, we are averaging 2 deaths per day at this point. That's been stable. And I'd like to note that August 31st was the first day that Chicago has had without a death from COVID-19, going all the way back to March. This is the hotspot analysis that we share week after week. You can look at some more detail on the website. But as you can see, even while we continue to see progress within some of the hardest hit neighborhoods, very clearly the northwest side, the southwest side, and then this small pocket down on the southeast side remain disproportionately impacted in terms of numbers of cases. And finally, I do want to highlight a couple of additional notes. So first of all, as we are making plans for the next 5 years, COVID is absolutely part of those plans. The City of Chicago sponsors a lot of testing, as you know. And in fact, in recent days and weeks, the city is actually funding between 25% and a third of all of the testing that is happening across all settings in Chicago. We've been very pleased by that uptake because, as you know, we push testing where it is most needed week after week. We look to see which neighborhoods are having high positivity rates or seeing surges in cases. We have some static sites, particularly in that northwest and southwest region where we continue to see a lot of cases, and then we move mobile sites. But that has been so successful that we want to make sure it can be maintained in the long term. So we're going to be following a model that Los Angeles has used for its similar mobile and community-based testing, where we are going to begin asking people who are getting testing through those city-sponsored sites for their insurance information if they have insurance information to provide. If they do not have insurance information, it is not a requirement to be tested. There is similarly not a requirement for identification. But if people have insurance information, we'll be collecting that because then we can actually bill the insurance companies and not have the City of Chicago bear the full cost for that test. There will be no copay for anyone who is getting tests. There will be no secondary charge from an insurance company. And again, anyone without insurance or without ID will continue to be able to get testing without any barriers. But this is a way for us to really be able to extend our testing capacity, make sure we can take it, through the long term and continue to support people, particularly if they're uninsured. So that's one change I wanted to announce. I also just wanted to share a little bit of information related to what we're seeing now for outbreaks and for situations in Chicago. So first and foremost, I cannot emphasize enough, private gatherings continue to be our major source of spread in the household, among extended families, among neighbors, and other people who understandably people feel comfortable with, and they don't wear their masks and they perhaps don't socially distance. So we continue to hear about spread in birthday parties and barbecues, in family celebrations and weddings. This week we had an outbreak at a retirement party, for example. Particularly when people are feeling the most comfortable and the most celebratory, I think especially when they're among folks who they trust, it can be at risk for spreading COVID. So please, continue to where you're gathering. If you're able to do that out of doors, it is safer than indoors. It is not completely safe though, and you need to make sure, no matter which setting you're in, that we continue to wear the face coverings, keep the social distance, do the hand washing, all the things that we know can limit risk. I also want to highlight that my team is focusing a lot on any cases that we're seeing in children, cases that we're seeing related to daycares or to any of the schools that are opening, to any of the sports gatherings. We are seeing some cases there. No major signs of spread throughout schools that have been open, although we're certainly investigating and continuing to keep a focus on that. Obviously, looking through the fall as we continue to share information and make decisions about schools, we will update if there are major things there. I do want to highlight that the athletic space has also been a space where we have seen spread, both among athletic teams. We've been working on some investigation related to soccer teams, for example, where people are not just interfacing on the field, but often getting together socially outside of the athletic situation. It can be hard to tease out what part of that interaction is responsible for spread. We also similarly had an outbreak related to a fitness boot camp setting where many folks were gathering to try to be healthy, which of course is something we support, but they were in an indoor setting and appropriately keeping the group gathering size to 10 at a time, but they were not consistently wearing masks in the indoor setting. And although I know it's hard to wear masks when you're exercising, particularly in those indoor settings, I'll remind you it is the requirement in Chicago. And part of that is because we want to avoid outbreaks like we've seen in this setting. Also want to remind people to please take the quarantine period seriously. If you've been advised that you need to quarantine because you've had close contact with someone with COVID, you need to complete the full 14 days of quarantine, regardless of whether you have a test result that is negative. You cannot test your way out of quarantine because it can take up to 14 days for the virus to take hold and in fact be able to show up in a test environment. And we have had cases of people, having an exposure, being concerned, testing very early, feeling like they're safe. They return to work, they return to school. Only later are they developing COVID, and in fact have been spreading it throughout that whole time. So just a reminder that if you're advised that you need to quarantine, that is for the full 14 days, regardless of a test result. And a last reminder that when contact tracers and case investigators are reaching out to you from the Chicago Department of Public Health or from any of the partners that we are increasingly bringing online, in which I shared news about yesterday, we will be keeping all of that information private. We do not share it with the federal government. We do not share it with credit agencies. We do not share it with financial institutions or the newspaper or your employer or anybody who wants to get that information. That information is kept secure. When we do the contact tracing for people who you let us know you may have been in contact with, we do not even share your identity. So I want to encourage people to be forthcoming when you're talking with our investigators. We have no goal other than to prevent the spread of COVID, to make sure you and anyone who you may have been in touch with is appropriately linked to medical care, is appropriately linked to testing, is appropriately linked to quarantine and isolation and any other supports that may be needed. So those were the reminders that my team asked me to pass on. Every week I talk to the teams that are doing the outreach every day, and these are some of the misperceptions they continue to hear. Finally, I'll just highlight that on Thursday from 2:30 to 4 is the Chicago Department of Public Health's virtual launch of Healthy Chicago 2025. This is our plan for the next 5 years to focus on the racial life expectancy gap here in Chicago, where Black Chicagoans live on average 8.8 years less long than white Chicagoans. And as a whole city, we have seen life expectancy dropping in all race ethnicity groups except white Chicagoans. We'll be talking about what drives that. We'll be talking about what we are planning to do as a health department and as a city, and importantly, what partners, and not just health partners, but businesses, nonprofits, NGO, the whole realm of folks who work across Chicago can join the Healthy Chicago 2025 movement, as together we really focus on thinking about health for all with a very specific focus on racial inequities. And with that, I'm happy to take questions.
Thank you, Dr. Arwady. The CDC says a new study for dining out makes you twice as likely to get coronavirus. Is the city considering added restrictions or measures? What could that mean for area restaurants?
Yes, so just for those who may not be aware, the CDC released what's called a case control study this week, where they compared people who had COVID with people who had symptoms but turned out not to have COVID and had presented to outpatient centers. And that's a good way to understand the risks, because you're not just asking all the people that got COVID what activities had they participated in, but you're comparing them to people who did not have COVID and seeing if there's a difference. And as you note, they asked about a whole range of different activities, and the one that proved statistically significant was that people who had eaten in a restaurant in the 14 days prior to getting the COVID diagnosis were more likely to be diagnosed with COVID. So what I would say, there's a couple pieces to this. Number one is that we know that unfortunately eating and drinking just by definition are a higher risk activity to do with other individuals, because you have to take your mask off. We've not figured out a way yet to eat and drink through a mask. And so that means that wherever you are dining, in a restaurant, in an outdoor bar, even in your home, because you can't have that mask, that is one additional layer of risk. Here in Chicago, I want to say that we have been, I think, quite cautious working with our restaurant partners on balancing the known risks of eating in restaurant settings with the very real economic hardship that comes particularly for smaller restaurants and even larger restaurants. We've had a 25% capacity in place maximum for restaurant settings and a maximum of 50 in an indoor setting. That is tighter than what has been allowed across much of the state. I will say that as parts of the state have surged, the state has moved to impose that 25% restriction in some other counties. But we've been very pleased with honestly what our restaurant situation has looked like. We have seen some individual small cases and potentially clusters linked to restaurants, but we've not seen major outbreaks. And as you know, we've done a lot of enforcement in that setting too, working with business affairs and consumer protection to make sure that where restaurants and other eating and drinking establishments are opening, that they are following all of the appropriate precautions. We have things in place here now, like requiring that mask when you're interfacing with your server, making sure that everybody is seated when you are in an environment, really having the mask in place. I feel confident that right now our restaurants are not a major source of spread. There is still some increased risk in that setting though, and so that's where we're really balancing what does our community setting look like. We need to get that percent positivity down a little bit lower. I'd like to obviously see our cases, if we're able to get them down below that 200 mark. These are all things that mean the risk to anybody is lower because you're less likely to have someone with COVID who doesn't know it. So we're not at a point right now. We're certainly looking at that in other studies where we're planning to further tighten any restrictions. In fact, I think if we were able to see significant progress over the next few weeks, we know, as things are getting colder, if we continue to not see this be a major source of spread, we may be in a setting where we can potentially even loosen some of those restrictions. But that is all dependent on us being in a little bit better situation as a community, and recognizing again that when you are eating in a restaurant, the people who you are eating with are in your bubble, like it or not. And so that can be a higher risk setting.
On that note of talking about the dining, you have gotten 600 submissions for the Winter Design Challenge.
Yes.
Have you seen any that could work to keep the restaurants running during the winter months?
So, I won't comment on the specifics, but there have been amazing creativity in terms of what's been submitted. And we've gotten ideas from actually all over the world. And absolutely, we've got a team that's going through, that's looking at the design, talking to buildings, talking to BACP, talking to the health department. We've done some outreach, actually even to the CDC, to look for a little bit of input and guidance around safety there. Certainly, there's the dual problem of COVID and needing to make sure that a space is warm enough in a way that doesn't pose a fire hazard, right? So it's not just sort of a beautiful design. It's about thinking about what this could look like. I think this has the potential to be part of a solution. I also recognize that us being in a place where, if we can keep COVID under reasonably good control here as we head into fall and winter, having some opportunity for indoor dining will probably be important. But that is a big if. If we have a major surge of cases in the fall and winter, we may not be in a setting where we're able to do that. So it's too early to know for sure, but certainly we've loved this creativity. We were joking about a coffee table book of some of these ideas, because the range of things that people are putting forward, I think, are some of the best of what Chicago has to offer, and more certainly will be coming there as we make our plans for the winter either way.
Thank you. The CDC also found that kids in daycare were spreading the virus to parents and daycare workers. Have you seen similar spread in city daycares? And if so, what is your message to parents?
Yeah, so daycares have obviously been a major focus all along from the beginning. They were one of our very first settings where we put an order in place that any case in a daycare setting had to be reported to the health department so we could investigate it. We have not seen major spread, to be honest, across daycares. We certainly continue to see individual cases, and many in staff, to be honest, as much as we're seeing them in children. Every time there is even a single case in a daycare setting, we're going in and investigating and putting all of the required quarantine and contact tracing that's in place and encouraging testing and follow-up. But at least here in Chicago, it has not been a major source of certainly large outbreaks or of major ways in which we are seeing cases introduced back into families. If anything, I think we're seeing more cases introduced into families where people are working in essential jobs.
From Block Club, a question, the first one. Do you have any concerns about the wildfire smoke that's traveled to Chicago?
So, of all of the things to worry about, it is not the highest on my list. I would say that, certainly what we have seen out west and the very dramatic effects of climate change, frankly, and the absolutely unbreathable air that we've seen out along the West Coast, I think is striking, and have certainly noted it with great concern, thinking about it from a respiratory disease standpoint acutely, as well as what it suggests in a long-term way. I think the fact that we see some of that now spreading, right, across the country, across the world, is just one more sign of the ways in which we're interconnected. Like, in a lot of ways, I think of it like COVID, right? You've got one part of the state, you've got one part of the country that's in trouble in one way. That trouble does not stay in that place. And so I think to me, it's more of just a reminder that environmental trouble in one part of the country, the world, the city can infect the rest of it. I have not seen any data myself about whether we've had a direct impact on air quality here, and I would certainly point people to that. I'll take a look myself in case there's anything that we need to put out an alert related to air quality, but I, at this point, am not aware of anything. We'll send an alert if there's any way in which people need to change their behavior here.
All right. The city of Chicago was at an average of more than 380 new cases just a few weeks ago, and now at 263. What do you think drove this recent drop?
Yeah. So first and foremost, I actually think we are making real progress in neighborhoods on COVID. And particularly, that's why I showed the data where a lot of that drop is coming from our hardest hit age groups and our hardest hit race and ethnic groups. That is exactly what I want to see. What I would not want to see is that drive coming from, in the spaces that we were already doing very well in. It's more important that we are making real progress in some of the parts of the city that have frankly had the most surging cases of late. So, we've had not just us, but many, many partners. I think there was a 23-point plan around outreach in Latino communities, and much partnering, much focus in terms of driving testing and resources and messaging. And I do think some of that is starting to pay off. I think we have seen broadly quite good mask adherence here in Chicago. There is always room for improvement, but compared to what we see in some other parts of the country and even the state, I think that has remained reasonably good. And I've been very reassured also, to be clear, that we've managed to keep our rates in our oldest Chicagoans really quite low. And that is very important. That's a big part of why we're not seeing the big impact at this point in hospitalizations and deaths, and it's part of what makes me feel more optimistic, right, as we're sort of moving ahead and looking at numbers. That is the sort of age distribution, if I have to choose one, that I would like to see. So I think certainly testing always plays a little bit of a conversational role. Like, I actually, the 263 that we're seeing today is, as I mentioned, a little bit driven by that 3-day Labor Day weekend. So we may see a little bit of an increase again as we're not seeing the effects of that anymore. But nevertheless, we're definitely down compared to where we were. We've got to get that percent positivity down, though, too. Not just the test positivity, but the person positivity, because that is reflective of broadly how we're doing as a city.
And that is what Steve Miller from WBBM Radio is asking. Could you go over again, what is the current positivity rate for the city of Chicago? How has that fluctuated over the past 6 months? And are we headed in the right direction?
Sure. So the current test positivity rate for the city of Chicago is 5.2%. And that, again, reflects the number of positive tests divided by all the tests that are done. So if somebody has had 4 tests, if one individual has had 4 COVID tests, that counts 4 times in that denominator, just to be clear. The lowest that we've seen that was probably in the high 3% to low 4% range back as we were coming out of shelter in place. We were able to hold it under 5% for a good month or two, and we've really been hovering around that 5% mark for about the last month. I do want to highlight, though, the person positivity, and I know this can get a little confusing for people, but it's important. The person positivity is where we take the positive tests in an individual divided by the number of individuals who are tested. So if someone has had 4 COVID tests, they would then only count once. And that positivity is 8.1%. And so that really, where we're looking at comparing across neighborhoods or across race and ethnic groups or ages, we use that because I don't want to skew it for someone who's had a whole lot of testing to make it look like we've done more testing in a neighborhood or in an age group. I really want to count that by individuals. So it can be a little confusing to have both of those. We mostly talk about that 5.2% because that is the number that the state focuses on and uses to compare across regions and makes decisions in terms of rollback. But that 8.1% is also an important marker, and frankly, where we look even a little closer as we make our decisions about where to push testing. You know, we had at the peak here, we had positivities that were 30, 40, 50%. Don't get me wrong. So this is much better. But there are parts of the country, the whole East Coast has positivities that are, 1%, even less than 1% in some settings. And I would like to see us down very consistently under 5%, and ideally really getting down where we're seeing that on the East Coast if we can get there.
Another one from WBBM, are people actually quarantining when they come back to Chicago from one of the states on the city's list? And how many people have been fined for not quarantining?
Yeah, so broadly, I would say the major impact that the quarantine order has had, which has been a really good, important one, has been to educate people about the risk of traveling. And I think mostly we've seen many people changing their travel plans. So that's actually the ultimate goal, that, if you do not need to travel to one of those red states right now, if you don't have a very good reason to do it, please don't travel now. We've also seen really good impact, I think, from businesses as well, who have recognized that the last thing they want to do is sort of run a risk of having an employee travel and seeing that come back. So the quarantine order has been one of the biggest lifts, I would say, that the Chicago Department of Public Health has had in terms of questions and impact and follow-on. But it has absolutely changed some of the patterns of travel, and it's one of the easiest ways, I think, that we have to make people understand that Chicago does not have a wall around it, and then where they are traveling to higher places, they have the potential for risk. We do continue to identify people who have traveled back and have not necessarily maintained that full quarantine. We have not been aggressive in terms of sort of fining those individuals. As you know, we have the capacity to do that. Typically, we've done more warning letters and making sure, again, that people are aware if we identify an additional problem, we could double down on that. It's a little bit of an issue of where do I prioritize some of that enforcement. Certainly if there's a setting where I've got someone who has egregiously sort of been out and spreading COVID and loud about it, I have the capacity to enforce there. But I'm mostly interested in using a lot of that enforcement work in our public settings. And so that's where the focus on things like the restaurants or the bars or the gatherings, where we have more capacity to send teams out, and I would argue make a bigger difference in terms of the public. That's where we put more of the enforcement messaging in. So it remains primarily educational effort, and I think in that regard it's been good.
What is your recommendation on fall sports, high school and college, football especially? Athletes, parents, and schools want to play. Should they?
Yeah, so we are following the state's guidance on this.
But if the state asked you, what would you tell them?
Yeah, so I would tell them that if we're not in a situation where it's safe to have Chicago public schools in session, I don't feel that we're in a safe situation to be playing sports, to be perfectly honest, where we're thinking about these sort of big community level decisions, particularly the higher risk sports. Let me be clear about that. As you know, there's been some differentiation at the state level between the higher risk contact sports and the medium and the lower. I think that the guidance that the state has put out is good. We're very much in agreement with it. We all have to make decisions, and I know how hard it is for people who are, for kids especially, and for athletes who are, thinking ahead towards college and thinking ahead towards scholarships. But I think that personally, being able to prioritize having in-person education takes an even higher priority for me than individual sports were. And so I don't see a setting where we would make any different recommendation than the state has made, or make a recommendation for having sports play when the school itself could not be open.
And any idea yet on what Halloween in Chicago will look like?
So the good news is we're still 6 weeks from Halloween. So we will see really what our data and our numbers are looking like. We know how important Halloween and a lot of those traditions and celebrations are, particularly to our youngest Chicagoans. We'll definitely be thinking about the ways in which we can celebrate Halloween in ways that are relatively safe from a COVID perspective. We know people are likely to celebrate. It's all about figuring out ways in which we can do that as a city that don't unnecessarily increase the risk for COVID spread. So there are discussions happening about that where I know people are interested, but I would say hold a little bit until we can see again what we're looking like over these next few weeks as we're heading into October, and know that there will be some opportunity for certainly celebrating some of the parts of Halloween.
But you do not imagine a door-to-door traditional trick-or-treat?
So we're going to have guidance that will be different in some way. I'm not going to get into the details of exactly what that's going to look like. People have said, are you canceling Halloween? I am not canceling Halloween. We are going to be thinking about how to do this in ways that are as safe as they can be. And, if we're at a place, in a best case scenario, if we could get our cases back down under 200, if we could get our percent positivity really, below 5% and heading down, we would be in a space where we would feel more comfortable for some of that. But nevertheless, the gathering sizes and whatnot will still be in place, and we'll need to be really careful about any risk that could bring.
I'm good. Those are the questions
Okay.
I've received.
All right.
Thank you.
Thank you.